Welcome to a beautiful Wednesday. Hello, good afternoon. The Pulse is coming to you live from our studios in Kokomlemle on your digital terrestrial TV because we're free to air on DSTV channel 421 and Go TV channel 144. We are your home of independent, fearless and credible journalism. This afternoon, Vice President Dr. Baumia launches National Electronic Pharmacy Policy and Guidelines. Government says will be a game changer for pharmaceutical care and ensuring inclusive pharmaceutical care in the country. We have details of how this works on the Pulse.
It's disheartening to see people spend so much time moving from one pharmacy to the another in search of medication. The innovation in improving pharmacy access to our people through e-pharmacy can be a game changer.
Also this afternoon, Ghana Health Service to enforce restrictions on large indoor events this Christmas despite a pushback by some event organizers who say it is too late to cancel their shows. We have details as public health experts warn a failure to contain the recent spikes in infections will drive the country into a fourth wave of the virus. Plus chaos as more identifiable groups condemn the violence exhibited last Monday by MPs. The NPP majority has been explaining the cause of the injury allegedly sustained by the Youth and Sports Minister. We'll hear from the House of Chiefs, which has also been commenting on the issue. My name is Aisha Ibrahim. The Pulse is brought to you by Global Community Zignilu Affordable Safe Sanitation. Remember, we're also streaming live on YouTube and all our social media handles at JoyNews on TV. Tweet at us with the hashtag The Pulse. My personal handle is at Denana Aisha. Please stay for detail.
Hello, my name is Nathaniel Atto. You can catch up with all the fun and inspiration on the Joy Sports link here on Joy 99.7 FM, together with all other shows over and over again. It's very simple. All you need to do is go to myjoyonline.com/podcast and relive all of those fun moments over and over again. Joy 99.7 FM, your radio for discerning listeners. Joy 99.7.
Suspected armed robbers have gunned down a mobile money vendor installing an undisclosed amount of money at Konongo in the Ashanti region. The two armed men, according to eyewitnesses, shot him in the chest after he refused to give them a bag containing money. Meanwhile, the regional police command has promised a reward for anybody who would volunteer information leading to the arrest of the suspect. Live FM's Rasta Sasaridonko is in the community and has filed this report.
So this is the private vehicle of Edward Jamfi, the deceased. And this is where he normally parks because the road leading to his house is unmotorable. So he parks here and walks about 50 meters to his house. So yesterday in the evening around 8:50, he parked his vehicle and walked over to his place of residence where he was shot.
Two men accosted him just behind his house and demanded he hands over a bag containing money.
This is where Edward Jamfi lives, and this is his mother's house. So where he lives is a boys' quarters. He passed through this lane to the boys' quarters, and we're learning that this is where he was killed. And in fact, he was followed right up to this end and accosted right here. And there are people who sleep in this room and they heard the conversation, what went on between him and the unknown assailants before he was gunned down right here. So you could see the blood spots right here. There is a pool of blood here, there is a pool of blood there, and some traces of blood here. Now, we're going to talk with this lady who was also sleeping in this room and heard the conversation that went on between him and the assailants. So she's telling me that she was in the room making a call, and all that she heard was that confrontation between him and the assailants, and they saying that he should give them something. And he said he won't give it to them. She heard the loud bang of the gun, and then she rushed out of the room with a cloth, and she said she wanted to come to his aid so that she would tie the place where he was shot. But when he came in, he was already dead.
So within, I think 1 minute after shot, I didn't know 1 minute. Because he shot in the car, inside me bani aid. See, no 1 minute, but me bani no.
He left behind a wife and 4 children. The youngest is 2 months old. Akuya Ampofwa is his wife.
Boys, me ban or somebody 450 million thousand.
There are people who needed their money. It was around 45,000, and they were the same people he promised that he was going to withdraw the money for them. And so she believes that these same people may be behind the people who shot him.
The regional police commander, DCOP Afo Boachi Yadom, and his team have visited the crime scene and spoken with the affected family. Regional Police Public Relations Officer ASP Godwin Ahianyo promised a reward for anybody who will volunteer information leading to the arrest of the suspects.
And they can say, to be few, build more, someone who could be someone. I will not command us say, put this information, but it will happen for no open officer.
Reporting for JoyNews, Erastus Asaredonko, Konongo, Ashanti region.
Erastus Asaredonko joins us with more on this one. Erastus, what more can you tell us on this incident?
Well, so I must say that the town is shocked at the turn of events, especially mobile money vendors. He was a super agent, they call him, and he was the one who gave e-cash to many of the vendors in the town. And so they love him very much. And he has sent some shots to these vendors who tell me that they have to, from today, close early. And they really have to watch out for people who may be tempting them or trying to follow them when they close. They've also been telling me about the fact that the banks close early. And so after close of work, if you want to deposit your daily sales, you cannot do that. And so many of them go home carrying these sums of cash with them at their own risk. And so that is what has been the talk of town for the whole day.
What has police preliminary investigations revealed? Do you know?
Well, for now, we've not been told anything by the police. The regional police commander himself was there at the crime scene together with the crime scene experts. For now, they say they are investigating and they are looking for clues. And so they want the public to help them with any information that they can gather. And so it's not clear. I think it's early days yet to see where investigations will lead.
Erastus Asaredonko is on that beat for us. I guess residents are living in fear now.
And in fact, there are people who think that he was followed from where he works. In fact, many people are throwing all manner of stories around. I'm hearing some of them close to where he works. You know, his shop is about 2 miles from his house. And so that was not where he was shot. He was shot just outside his house. But there are people who think that there are some people who came to him during the day requesting to withdraw some huge amount of money, about 45,000 Ghana cedis. I'm also getting information that these same people went to the wife to ask whether he has been home. And so they believe that it was at that point that they followed him, tracked him to his house, and then killed him. There are people who are also talking about power outages in that area, which they say is not helping with the security of the community.
Rasa Soridonko is monitoring this for us. We certainly will bring you updates on this once we get from the police. Now, government has launched the National Electronic Pharmacy Policy and Guidelines to ensure inclusive pharmaceutical care in the country. It would also lead to full operationalization of a digital platform for providing pharmaceutical services across the country next year. Launching the platform, Vice President Dr. Mamadou Baumia explained the digitalization of pharmacies would have the nation's pharmaceutical companies converged on one digital platform to address the difficulties of roaming and looking for medicines, ensure competitive pricing and sale of genuine medicines to the public. The e-pharmacy platform is aimed, according to the Vice President, at addressing 4 key concerns of health system, including reducing pharmacist to patients ratio, improving confidentiality of health information and privacy of patients, medical records, and minimizing counterfeit and substandard medication in the country.
Why e-pharmacy? This innovation is dear to the government. A few years ago, at the annual general meeting of pharmacists, I threw a challenge to the pharmacists present. How can we use technology to improve access to pharmaceutical care in Ghana in a manner that complements our traditional brick-and-mortar pharmacy? Yes, there is that personal touch to the traditional face-to-face patient-pharmacist relationship, but there are ways that technology can improve access and delivery, especially to the large segment of the population scattered in the rural areas and the less urban areas. And even for those in the urban areas, how can technology reduce the information costs and transaction costs in accessing pharmaceutical services? Ladies and gentlemen, the innovations in our national health insurance, the deepening in training of our human resources and recruitment of health personnel, one constituency, one ambulance, the use of drones in the delivery of drugs, the innovation in institutional digital frameworks of the health sector, the agenda to build 111 health facilities to augment the existing ones are all major steps in achieving our goals. While tackling the inadequate infrastructure in the health sector, it is disheartening to see people spend so much time moving from one pharmacy to the another in search of medication. The innovation in improving pharmacy access to our people through e-pharmacy can be a game changer in safeguarding the future of our youth and ensuring national and responsible access to medicines on a scale we have not yet been able to achieve. Today, we are adding to the growing list of digitized platforms. E-pharmacy should help us address concerns for the proliferation of fake drugs and licensed pharmacy operations, reduce disparities in the cost of medicines, and tackle some of the major administrative and delivery issues that affect the practice of pharmacy.
We can now speak with a public health pharmacist, Sheikh Farm Ibrahim Ibn Sana, who has joined us via Zoom for more. Thanks so much, Doc, for your time. What does the launch of the e-pharmacy mean to health delivery in our country? Hello, Sheikh Ibn Sana, kindly unmute for me.
Oh, okay. Thank you. Can you hear me now?
Loud and clear.
Okay, that's very beautiful. The e-pharmacy launched today, which was graced by the Vice President, His Excellency Dr. Mahmoud Baumia, was timely welcome because, like he said, there has not been full access in the pharmaceutical sector. A number of people would have to crisscross one place to the other, looking to fill one prescription, and they would not get. So in addition to the fact that they are spending money, there's also the tiredness, the time wasted looking to fill a prescription, and then also delay in pharmaceutical care in the wards. So the e-pharmacy concept is a pharmacy that is registered retail pharmacy, just like we have with the brick and mortar pharmacies that engages in business day to day, just like what we see on our environment. But this time, you are doing it on an electronic base, on an internet base. So you can receive a prescription online, and then you can validate the prescription and then fill the prescription and get the medication delivered to the person who is at the ward or who needs the medication without the person moving from where he or she is staying. So basically, that is what the e-pharmacy has come to do. It's made sure that pharmaceutical services would reach every nook and cranny of this country. And then all those who have no access to certain particular medications, you have to go to maybe Tema to get the medications or move from Kolebu to another place in town to get the medications. This time round, with the e-pharmacy platform, there's a leverage. There's a leverage for each and every one. You can access medicines across the country, anywhere you are, if you launch yourself on the e-pharmacy platform. And that is what is the innovation that has come to the market.
Objective of this platform is to sanitize the system by dealing with issue of fake drugs in the system. How does this work?
Usually the platform is such that you need to register, and in addition to the registration, all the medications that are uploaded on the e-pharmacy platform would be registered by the FDA. In this way, all the medications that are on the e-pharmacy platform have their batch numbers registered, verified, and validated by the FDA. So the issues of contraband goods, fake drugs, substandard products can all be dealt with by the Pharmacy Council and the FDA. So the general populace are very much assured of a quality medication. And then also, there is a database that is going to be housed at the premises of the Pharmacy Council, which is riding on the national platform, digitalization platform. So that will also be monitored. So once it's riding on that platform, it is easy to check with the batch numbers of the medications, which are good drugs and which are bad drugs. So any other substandard product cannot find itself there. Currently on the market, there's difficulty with staffing levels of the Pharmacy Council and the other regulatory bodies in checking every corner of the country which drugs are really good and which drugs are really not good. But with the e-pharmacy platform, you have a standardized platform where all facilities that enroll on the e-pharmacy platform are checked and validated before, and then also you register. You are registered, and there are a number of conditions for you to fill before you enroll on the e-pharmacy platform. Pharmacy Council opens a logo that indicates that these pharmacies are certified to undertake the e-pharmacy platform. So this one is very efficient.
Now, let's talk about patients engaging pharmacists before and also assessing prescribed medicines conveniently, as you put it. How does this system work?
It works in the sense that for each facility that want to be enrolled on the e-pharmacy platform, there must be a registered pharmacist available. Also on the pharmacy delivery point and also at the Pharmacy Council database, there are pharmacists all over placed at vantage point who will receive prescriptions from a medical doctor, a prescriber, or any other health professional that is mandated to prescribe. They would validate, and then it also offers a platform for an interaction with the patient. Then it also offers another platform for the delivery of the medications and the confirmation of the delivery. For example, if I send medication to you in Takrady or I send medication to you in Tema and I'm here, there's a system where once the medication gets to you, we can have a notification that you have gotten the medication. But before then, any other questions that has to be answered or talked about, any counseling point that needs to be delivered, are delivered by the pharmacist in there together with the patient.
So this is supposed to be across the country, right? One obstacle stares us in the face in areas where internet connectivity is bad. How does this work in the hinterlands, for instance, in the rural areas? How do patients there access this facility?
Yeah, so in the first place, this is across the national database. This one is going to ride on the government's .gov database. So the whole country, the government is embarking on the desalinization program. The program is supposed to be enrolled fully or operationalized by 2022. Now consultations are going on to make internet facilities accessible to any of the areas that do not have internet, which means that internet penetrability will have to be increased to all parts of the country. The nice aspect of it is that you can use your mobile phone to access it. You can use so long as the people have a mobile phone, an Android mobile phone, they can access the facility. The same thing for pharmacies that they can access. Many people have mobile phones now, but the government has given an assurance that since it's riding on the national digitalization platform, which is internet-based and is rolled all over the country, every nook and corner of the country will be covered.
So if I want to log on to this platform, what do I do?
If you log on to this platform, you just go to there will be an e-pharmacy logo that will be provided for by at the end of this year and operationalized by next year, 2022. That logo, you can go on your mobile phone and download that logo, and then you are there on the e-pharmacy platform. Each individual pharmacy will have logos. The same logo will be embossed on each individual pharmacy that has been enrolled on the e-pharmacy platform, and they can also be eligible to let the clients know that they can just log on to the pharmacy and then they'll be on the e-pharmacy platform.
I'm grateful for your time. Sheikh Fahmi Ibrahim Ibn Sana, he's a public health pharmacist. Let's stay on health a while longer because the Ghana Health Service says it will go ahead to enforce its latest restrictions on large indoor events this Christmas, despite a pushback by some event organizers who say it is too late to cancel their shows. The Health Service served notice that it will not allow large indoor events following the latest spikes in the country's COVID cases. Ghana's active COVID-19 cases currently stand at 1,602 after 321 new cases were recorded in the last reporting window. This is the highest jump in new infections since the end of the third wave. Well, this afternoon, the Ghana Health Service says it is working with the Ghana Tourism Authority to enforce its latest restrictions on large indoor events.
We are encouraging only open door events as short as possible, and so we have a team that we're working with the tourism board, but as much as possible everybody must avoid an indoor event.
But Dr. Kumabwaji, there are a lot of indoor events being advertised. What is going to happen? I mean, you've talked about you teaming up with the Ghana Tourism Authority. What are you going to do now? Yesterday there was an indoor event. There will be indoor events, on the 24th, 25th, 26th. What are you going to do about these indoor events?
Well, we'll recommend that you do it in an open space for the sake of all Ghanaians.
If a country,
we are working with tourism board, who are the authority to engage such people and also give them. And we are working very closely together.
So if it can't be done in the open space around that time, will the event still come off?
I say we will continue to engage.
Yes, but I want to understand something. So as you engage...
Well, it should be in the interest of all of us that such an event doesn't take place. But I say that we are not going to say, by all means, don't do it. We have the process of engagement and providing alternatives for such events to take place.
Alternatives. And the alternatives will be change of venue.
An open space.
An open space.
Where it's safer. Where we feel all feel safer.
Okay.
With Head of Health Promotions and Risk Communication of COVID-19 at the Ghana Health Service, Dr. Aboagye Da Costa. He joins me via Zoom. Thanks so much, Doc, for your time this afternoon. So how is our situation looking like now in terms of infections and spread distribution?
Thank you, Aisha. Good afternoon to all your viewers. In fact, we normally put it on our dashboard because the data I have might be different from what has been put there because we have the live update. But the last time we checked, it was around 3,000 active cases. So it means that our situation is looking bad. And we really have to make sure that we put in some measures this Christmas to avert any possible fourth wave.
In these cases, do you know whether we are also recording severe and critical cases among the cases that are rising?
Well, I think our isolation centers are not full in terms of in-country. We still have a lot of spaces. The fact is, once you pick up the signs, then you must begin to act because we don't want to wait till, we are overwhelmed, that then we start to. So we are preparing our isolation centers, our treatment centers, but at the moment, the cases are going up. Then the thing is, for the airport cases, the government was using a facility at one time. Now, because of the increase in numbers, we have to resort to hotels, additional hotels. And now that is where I can say that the problem is. But in terms of our own treatment centers, no, they are not full. But the signs are there that if we are not careful, it could be.
What's the situation at the airport right now?
To be honest with you, compliance has been very good. I haven't heard of any problems. I know of some small videos that's been circulated by people, which we are engaging, but we will not bend our rules for anyone. And any of our staff that is caught in any act of illegality will be dealt with. So they know. And I believe that compliance is actually the key. And we continue to monitor the situation and see, but at the moment, the cases are still going up at the airports.
But what's the status of our vaccination also across board?
Okay, so thank you so much. So again, the data I may have, I've just had a meeting with the Director General. The data I may have may be different from what is out there. I know that we have done more than about 9.5, almost 10 million doses. Okay. So, but I think what I reported would be around 7 million or 6.9. So again, it is still different, but it's going on well. For example, yesterday, the Ghana Football Association alerted us that a lot of people will be coming to their premises. So we had to set up a center at their premises, and we did set the center at their premises, and we vaccinated a lot of people. So it's going well. We are visiting other places to make sure that people get opportunity or access to the vaccines.
Has it come to your notice that someone has taken you to court on their compulsory vaccination?
Yes. We are not enforcing the compulsory vaccination. So if someone takes us to court, I don't know what the person is seeking to do anyway. We are just enhancing our airport protocols, and we are saying that under Section 26 of the Public Health Act 2012, 851, we are public vaccinators. We are allowed to vaccinate people that are coming in with any disease. And it is clear. If you talk about the mandatory or compulsory vaccination, we have not started enforcing it. So I don't know why someone would take us to court. Maybe, I don't know what the person seeks to. But we have lawyers. So we have lawyers. So I think our lawyers will be reviewing it and advising appropriately. But I can say that we are not doing any compulsory vaccination. We are only going by what the Public Health Act says in Section 26 of the of Act 851, Public Health Act 2012.
Now, you have indicated that you seek to cancel large indoor events this Christmas. That may pose a danger, but I mean, you say even if the event will pose a danger, then you would cancel it. Event organizers say it's too late. First, let me ask why this decision, because I know already there's the no vaccination, no entry policy for all events this Christmas.
Okay, so thank you so much. Let me start by saying that this afternoon we have had a meeting with some of the event organizers, the big ones, and we have obviously insisted that events should be held outdoor. Now, they have also presented their challenges, because some are saying that they've advertised the programs for about 2-3 months, and canceling their programs now will cause a lot of, will have a lot of consequences financially and other things to them. So we had the opportunity to also inspect some of the venues, and what we still advise is that it should be outdoor. The event should be outdoor with a lot of ventilation. For example, there is one that is going to be at the, I think, where I visited was the conference center or something. There is a tent where they have a lot of spaces. Arena. They said it's called the arena or something.
Yes.
So what we've done is we inspected the place. We saw that obviously the doors, they have big doors so ventilation can come in there. Then also it's going to be half the number. They were going to take 4,000. We agreed that they should take about only 1/3 of the number. And if you look at the protocols will be there. We set up vaccination center. And so we are engaged. At this point, engagement is the key, because we really want, obviously, things to move on. But we also want to make sure that people do not abuse the rules. So we are obviously in talks with all event organizers, including the Christian community, so that we find, obviously, the best way around this.
For the public, what should be the watchword this Christmas?
I think the watchword is get vaccinated, wear your mask everywhere you go, and obey the protocols. Where necessary, have your events, even in your homes, have it at outdoor. And be careful, because the virus is in country, and the new variant is in country and is spreading very fast. So we need to watch. We need to take care of ourselves. It is like, I will repeat the words of the WHO Director General. It is really good to make sure that you are alive than to be sorry that you lost friends, family, or yourself. So it's very important that we all take this precaution very seriously and abide by it.
I'm grateful for your time, Dr. Aboagye Da Costa. He's Head of Health Promotion. Let's now check our situation with regards to COVID-19. We have new cases now standing at 509, active cases now at 2,428, confirmed cases now at 133,555, and recoveries now standing at 129,862. Deaths have certainly passed the 1,000 mark. We are 1,266. We can now speak with our correspondents across the country and see how people are protecting themselves. Let's start with the northern region, Tamale, and speak with Martina Buguri. Martina, what can you report from Tamale?
had a breakdown of how the region is doing in terms of vaccination, and then we come to what people are doing ahead of the Christmas. The region has done just around 4.9% of those who have been fully vaccinated out of the 1.2 million people they are targeted, and just 17.6 people have received at least one dose of the vaccine. It means that the region has to do more than 80% to be able to get the 1.2 million people vaccinated. 256,454 doses of AstraZeneca have been administered, 10,000 Moderna, and 16,872 Pfizer. Those have been administered. We are told that most people are waiting for the Johnson & Johnson, and the region has just received a large dose of it, and they are expected to administer this December. We are told that about third of the doses that have been administered were done just this December. And so the Ghana Health Service is hoping that at least by the end of the year going into the new year, say the festive season, they would have done about 10,000 doses of Johnson & Johnson. The Ghana Health Service Deputy Public Health Director, Dr. Abreu, addressed the media this morning, and he says that a total of 284,377 doses of vaccinations have been administered in the region. Now, the region currently has no active case. We have 17 deaths, and then we have 1,237 total case counts for this year. What people are doing now, fortunately, the hammer time is here, and so normally during the hammer time, you have people wearing the mask to prevent themselves from dust entering them. And so it's an opportunity. So we have seen an increase of people using the face mask. But when it comes to the protocol of washing hands, using the sanitizer, that is lost, especially institutions and then gatherings. So you go to most gatherings, we don't have sanitary conditions that you need to adhere to the protocol. So basically, yes, people are beginning to wear the nose mask, not because of COVID-19, but because the weather is getting bad, it's getting dusty, and people need to have better air to breathe, so they are wearing the nose mask.
And are there large events expected this Christmas in the region that you know of?
It started already. We have had 2 big concerts at the Tamale Sports Stadium. On Sunday, we had a big show at one of the sports in the region, and they are expected to have more concerts and big events at sports in the region. And so we are expected to see more gatherings as the festive season picks up.
Martina Bugri there from Tamale. So at this large events, do you see people actually wearing their nose mask and keeping the physical distances?
That is not observed at all. And that is why the Ghana Health Service is calling on the people in the region that they believe that festive seasons are fertile grounds for the virus to spread very fast. And so they are expecting residents to at least adhere to the washing of hands and then the social distancing. If the wearing of the mask is a difficulty, but they are hoping that people will just adhere to the protocols and strictly do it.
Bugri is from Tamale, and she's been telling us more on what people are doing to protect themselves. Let's get to the Bono East region. Anas Sabit joins us via Zoom. Anas Sabit, what can you report from your region? Hello, Anas.
Aisha.
Yes, Anas, go ahead.
Yes, the situation here in the Bono East region, cumulatively, the region has recorded a total of 2,000 561 cases and 64 deaths.
Okay.
Out of this number of people who have died, 50 of them lost their lives this year. So a lot of the people who have lost their lives through COVID-19 happened in the year 2021. With a case fatality of 2.5, the figure regional health authorities are saying is way higher than the national average. We have currently 6 active cases in the region. As at Monday, it was 3, and today we have 6. 4 of them are mild cases, and 2 of them are, severe cases, according to the health directorate. Now, in terms of the vaccinations, we have over 30% of the targeted population in the region receiving their jabs. We know 3 municipalities, Tichiman, Kintampo, and Kranza, have recorded more than 70% of the cumulative cases recorded in the region. And so health authorities are quite concerned about how these 3 municipalities or these 3 areas are contributing to the figures. Vaccine hesitancy is not so much an issue in these 3 areas because of the figures they've contributed. But the issue has to do with the rural areas where health authorities say more education needs to be conducted or done in the far east, through west areas, in order to have more of such people also accepting the COVID-19 vaccine. So in a nutshell, this is the situation here in the Borno East region.
How are the people themselves comporting themselves or taking care of themselves as far as preventing spread is concerned?
Yes, Asha, currently you could see there is an increase in the number of people using the face masks. You go to the streets, so you see a lot of people with the mask on. Maybe the weather could be a factor because there's so much dust in the weather lately. And as a result, you see a lot of people, especially those riding, almost all of them being in masks. And then also when you walk through the market areas, you see a lot of people masking up. But apart from the nose masks, hand washing, hardly do you even see hand washing bowls or Veronica buckets as we used to see them earlier. And social distancing is also not something that is being adhered to lately here. So that is what I can say with regards to the adherence to the protocols. Face masking or nose masking is up, but the rest are quite low in the various areas in the region.
The Borno region usually doesn't see like outdoor or indoor big events happening during Christmas. Are we seeing something like that this time?
Yes, the Borno East region, I'm in the Borno East region. We have a lot of these events or such events coming up. I know quite a couple of them on the 24th, 25th through the New Year, that is January 1st. I know there will be a number of such events likely going to be held because we see flyers here and there. So there is something health authorities are concerned about. I have been able to engage the regional health director, and he is urging or cautioning the public to stay away from partying with strangers and then avoid crowded places. And he says, if possible, when you're thinking of having an event, it should be outdoor and not indoor. So more education is being conducted on various media platforms to raise awareness on the rising figures we are recording in the region as well.
Anas Sabit is from the Borno East region. Ashanti region is one of the regions that is recording higher cases. It used to follow Greater Accra closely. Now it seems to be taking over. Ohime Teria has joined us from the Ashanti region. Ohime, how is Kumasi looking like?
Yes, Aisha, thank you. For the Ashanti region, health authorities are concerned with the fact that the region has entered its 4th wave. Based on the current figures the region has been recording as far as COVID-19 is concerned, health authorities are not happy because, for instance, if you look at the last 2 weeks, before then, the region was recording 1 or 2 cases. But the last 2 weeks, the figures jumped from 1 to 49. And as at this period, that is week 50 of the survey that the region has been recording, between 13th to 19th December, the region recorded 179 new cases, 171 new confirmed cases of COVID-19. So this is giving some cause of worry to health authorities in the region, and they are encouraging people to go back to the safety protocols. That is hand washing, under running water with soap, the wearing of a face mask, and all the other protocols that were, introduced. And if you look at the new trend, what it means is that cumulatively, the region has recorded 353 cases per 100,000, of the population. So if you look at every 100,000 of the population, it means 355 of the people are COVID-19 positive. And then as at the period, 7 out of the 43 districts in the region has also recorded new cases, with the Wasi East district recording the highest proportion of 52.05%. So that has been the COVID situation in the Ashanti region.
Ohiming, I know in Kumasi there are usually also these kind of events that happen. Are there some that we know of?
Yes, there has been several, entertainment programs lined up for the Christmas festivities, and then during the New Year period. So most of these activities are majority of them, I must say, are indoor events. Some being music events, some are also, comedy events here and there. But in some cases, some of the organizers have made it, COVID-19 vaccination compulsory, that you show your COVID-19 vaccination card, then you're allowed to enter or participate in these events. But there's also concern that some of these events that are indoors should be pushed, outside to the outdoor, open air, open space, so people can enjoy without contracting or coming into contact with COVID-19. So that is also there. But as to whether the residents will, adhere to the COVID-19 protocols as being advised, is also another thing.
Generally, what are you picking up? Are they willing, or are they even complying as at now?
Most of the activities the events are coming up, especially either on 25th or 25th, and then some are also on January 1. But the last event that happened, unfortunately, yes, the event organizers insisted that you come with your COVID-19, vaccination card. For instance, you remember the MPP delegates conference, for instance, though it is not an entertainment event, but it was one of the biggest events to happen in the Ashanti region ahead of the end of this year. Many people came, but COVID-19, vaccination card was an entry requirement for people to go in there. But that was the venue itself. But there were people who had not been vaccinated but converged outside the premises. So these are concerns that health authorities have raised, that the event ground itself will ensure strict compliance, that you come with your COVID-19 vaccination card. But what about those who gather outside the premises to converge, talk among themselves and all that? So they are encouraging that majority of these events should be pushed, outdoor.
Ohiming Teria is our man from the Ashanti region, and this shows, Ohiming, that generally, if you look at compliance to the protocols, it hasn't been encouraging, right?
Not at all, not that I know. When you are in town, when you are in the commercial buses, you see people, if you count, let's say 10 people, you only see just one person, for instance, wearing the face mask. So the wearing of face masks is an issue. The washing of hands with soap and running water is also an issue. And not majority of the safety protocols, people are not adhering to them. You go to the offices and the public places, you don't find the water that used to be around. So nowadays, people have an edge and they are not even observing the safety protocols at all, Aisha.
Let's head to the Upper West region and speak with Rafiq Salam. Rafiq, the Upper West region has done well compared to the Ashanti region and the Greater Accra region, but that does not erase the fact that people are still contracting in the Upper West region. What is the situation right now in the Upper West region? Kindly unmute for me, Rafiq. Okay, so Rafiq Salam is from the Upper West region, and if you look at the the dashboard, the COVID-19 dashboard, and you look at the region distribution, you realize that the Upper West region has done quite well, especially with the spread of the virus. So the chart shows a decline in active cases from October until the middle of November, and then in December there's been an upward trend, and this is likely to usher us into a fourth wave. That's what the health experts are telling us. But if you look at the regional distribution, you will realize that Upper West region is doing quite better. I mean, if you compare it to the Greater Accra region, Ashanti region, Eastern region, Upper West region is doing quite well there. But still, there are people who are contracting the virus over there. As to whether the people themselves are aware of what is happening and whether they are taking precaution to ensure they do not contract the diseases and do not also spread it is one thing we seek to know from Rafiq Salam, who has joined us again. Rafiq Salam, if you can hear me, I want you to paint a picture of how WA is looking right now. Rafiq, you need to unmute. All right, so we may have to drop Rafiq and raise him again to tell us about what is happening in WA. Definitely the figures have risen, and if you look at the dashboard we showed you earlier, there are new cases. I mean, if you look at just within one window, the new cases are alarming, and this is getting health experts worried. You just heard from Dr. Da Costa Abuaje, who says that, I mean, from the look of things, we would have to try and at least cancel some shows that have large numbers that will be held indoors. He just told us that at one of the events, they were able to agree on reducing the numbers to just 1/3 of the original number that they were going to accommodate. And he also said they ensured that there are big door space, there are spaces that will allow in a lot of ventilation for the people who will be patronizing these events, so they will be safe. Rafiq Salam is back on the phone. Rafiq, tell me how WA is looking like this afternoon.
In terms of the compliance with the COVID-19 protocols in the airport, it's not different as the rest of the country. For the Upper West region, I jokingly said some few days ago that it's only the Upper West region minister or the regional director of the Ghana Health Services. They are the ones who are only using the face or nose mask at the moment. You go anywhere in the Upper West region, people are not really respecting the safety protocols. The markets are west on the street. It's nothing to write them over. And so many of the people are of the opinion that it's by His grace that people in the region are surviving, but it's not due to any tactical or any things that are put in place by the authorities.
Rafiq, I usually don't see some of these large concerts, large programs, events happening in the Upper West region. Is it different this year?
We haven't gotten any large conference that took place in the Upper West region. The only thing that comes to mind, that came to mind for now, was about the Northern Development Summit, which took place at Juba, where a host of stakeholders are converging to talk about the northern region. But that one it was done under all the protocols, hand washing, everything was put in place there. But we haven't gotten any complaints. But in the Upper West Virginia, we have gotten funerals, and then also talking about outdoor events, and then and weddings, and that's where much of the crowd is in the Upper West Virginia. And so, but you go to these places, these protocols are not respected. Even the last time, I don't even remember the last time I saw a Veronica bucket in the Upper West Virginia, because they are not used in the regions now.
Authorities not worried about the situation in the region?
Health authorities are really deeply worried to the marrow about the situation. As I told you earlier, it's just by His grace that the people in the region are surviving. You go to our market park, honestly, they are simply not respecting these safety health protocols. And so it's really a health concern for the people. But the health authorities are somehow happy the vaccination is taking place in the region, because not many people are having those kind of views about weird views about the vaccine going to do something untoward to them. So people are really complying with regards to what was purported to have said some few months ago.
People are availing themselves for the vaccination, right?
Yes, very, very.
Right. Rafiq Salam is our man in the Upper West region, and he's been telling us the situation in the Upper West region. As Christmas approaches, how are the people bracing themselves for the festive season? Well, elsewhere in Europe, there's been phenomenal increase in cases. Europe had hoped for a normal holiday season as the region heads into its second pandemic Christmas, but things are looking grim. Governments are scrambling to find ways to keep the Omicron variant at bay and avoid a massive wave of transmissions over the holidays. For more, we are joined by our DW correspondent, Nicole Froelich from Berlin. Nicole, Germany is set to tighten COVID restrictions once again, but will it be enough to stop the advance of the Omicron variant?
Doubt it. State and federal leaders on Tuesday agreed to impose new measures, fairly mild measures, and measures that won't come into effect until after the Christmas holidays, therefore giving the Omicron variant a significant advantage. And that is an idea the scientific community doesn't like at all. The Center for Disease Control here in Germany, the Robert Koch Institute, is urging everybody to immediately reduce all their personal contacts to an absolute minimum, and would also like to see more robust action coming from the government in the shape, for example, of an extension of the school holidays or a closure of all non-essential businesses, because according to their calculations, the Omicron variant has the power to not only crush the already struggling healthcare system, but could potentially endanger Germany's entire critical infrastructure.
So across Germany, protests against COVID policies have been growing over the past weeks. Why are people taking to the streets?
Of people took to the streets in dozens of cities to protest against vaccine mandates, something that is not yet a reality here in Germany, but that is being hotly debated. Protests like this had been seen before in other countries as well, so it wasn't really a surprise that they would arrive in Germany, a country with a high rate of vaccine hesitancy. But what is worrying authorities is an increasing radicalization of the people taking part in these protests. Over the past weeks, we've witnessed people marching with torches to the private homes of politicians, murder plots against state premiers, and a growing infiltration by the far right in this movement. And that is something that the authorities are keeping a very close eye on. We do have to point out, though, that this is a very loud, a very vocal minority. 71% of Germans would actually like to see a general vaccine mandate.
So what's the situation in the rest of Europe as it heads into the Christmas holidays, Nicole?
Omicron is certainly taking Europe by storm. It's already the dominant strain in various countries, and it's promising to overtake Delta across the region in only a matter of days. So we're seeing a lot of measures being taken. The British government, for example, taking a similar approach to the one we're seeing here in Germany. Restrictions, yes, they are coming, but only after the Christmas holidays. Meanwhile, in the Netherlands, people are already knee deep in a full Christmas lockdown that lasts until mid-January at at least. People in Sweden are back to working from home, and Spain too is grappling with an explosion of cases that has happened over the past week. So a lot of uncertainty here going into the holidays. The head of the WHO has warned that we will see a dramatic surge in cases and deaths after Christmas, and has said that it is better to cancel gatherings than to cancel a life.
Thank you so much, Nicole Furlish is DW correspondent from Berlin. We'll take a break on The Pulse this afternoon. Don't forget to join us via all our social media handles and also tweet at us with the hashtag The Pulse.
What's up, guys? My name is Sammy Forson, host of the Weekend City Show and Ignition right here on Joy 99.7 FM. Well, anytime you happen to be busy and you miss out on your favorite shows right here on Joy FM, here's what you can do. Log on to myjoyonline.com/podcast. Just go on there and you'll find all your shows on demand 24/7. There you can catch up. Remember, Joy FM remains your radio for discerning listeners.
Welcome back to The Pulse. To the rest of our story. Special Group Occupy Ghana is demanding the immediate prosecution of members of parliament who engaged in a brawl on the floor Tuesday dawn. Parliamentarians have failed to reach a consensus on the proposed e-levy. While the majority welcomed the bill, the minority kicked against it, insisting the bill, if passed in its current state, will burden the ordinary Ghanaian. A debate to determine the fate of the bill turned messy, with MPs throwing punches at each other. Condemning the conduct of parliamentarian, Special Group Occupy Ghana insists MPs caught on camera engaging in the brawl should be made to face the law. On your screens now is excerpts of the statement that they issued today, and it reads, Occupy Ghana is deeply dismayed and disappointed at what is becoming the regular violent misbehavior of members of parliament. The nation witnessed the latest mass violent misbehavior on December 20 on the floor of parliament. MPs were aware yet unconcerned that the entire nation was watching on live television when they engaged in despicable acts of trading insults and punches in a manner that can best be described as uncouth. What our MPs appear to have blissfully forgotten is that whenever coups have interrupted our democratic dispensations, it is Parliament that suffers the most. But over and over again, and in less than 12 months, this Parliament of the Fourth Republic has abandoned even pretense of good and democratic behavior. No Ghanaian, regardless of their political party affiliation, should treat this misbehavior by our MPs lightly. That is why Occupy Ghana believes that the usual unqualified apology will not suffice. Since the law is no respecter of persons, those MPs caught on camera engaging in violence should be made to face the law. We note that the police have already indicated by its public statement that it is powerless to intervene in this matter. We disagree. None of the immunities granted by the Constitution to MPs in Articles 115 to 120 covers crimes committed anywhere, including the floor of Parliament. Specifically, the MP's immunity in Article 116 is limited to any matter or thing brought by him in or before Parliament by petition, bill, motion, or otherwise. We doubt that this Parliament and its leadership will have the decency or courage to charge and punish any of these members for contempt under the Parliament Act 1965 Act 300, but surely those with prosecutorial power must institute criminal prosecution. While we all may bear some blame for tolerating this level of despicably bad behavior from our elected officials in giving them a pass whenever they misbehave and then apologize, this is when Ghanaians draw a line in the sand. Ghana deserves better. We need to restore confidence in Parliament by punishing every erring MP. And it's from Occupy Ghana. Well, the National House of Chiefs is urging Parliament to restrain from the use of violence in periods of deadlock. President of the House, Ojiahoho Iyaojebi II, speaks for the group.
Nananom, permit me also to use this platform to urge our parliamentarians on both sides of the House to exercise restraint and resort to dialogue and engagement on broad national issues to arrive at consensus. It is just unfortunate that in recent times our parliamentarians decide to exchange blows on the floor of the House. This thing does not affect only the parliamentarians, but it affects Nananum and the good people of this country. So we are appealing to them to exercise restraint and make sure, because we believe they are all responsible people, and that is why we call them honorables. And they should always jaw instead of turning the floor of the House into arena of boxing. Indeed, the equal numerical strength in the 8th Parliament is an indication that Ghanaians want our legislators to work together.
Meanwhile, minority spokesperson on finance, Dr. Kesela Tofolson, says his side of the House is willing to reach a compromise if only government sees reason with their suggestions. He spoke on PM Express last night.
That have made an attempt to impose a similar tax, particularly on mobile money, not the other ones, the mobile money. And the fact that they received a lot of resistance because of A, B, C, D. So let's learn from those countries. And the analysis was, for instance, in a particular country like Tanzania, the very tax policy relating to the mobile money was subsequently revised. The rate was revised by 50%. So why don't we do something similar coming from the minority leader? It does not necessarily mean that the minority leader had said that he wants 1%. In the statement, he said that, look, we have looked at the analysis, we've looked at countries in Africa, and none of them has a tax policy of that similar tax policy with a rate of above 1%. We've seen 0.5, we've seen 1%, we've seen 0.2%. So even if you are trying to impose a levy of the sort, don't let it exceed that threshold.
So you were happy if it was 1% then?
No, not a way. I have said from day one that I do not support mobile money. So my posture is don't tax Momo. And most importantly, my major concern has to do with the exemptions, the 100 cities that they are exempted.
It's too small?
It is negligible. In fact, the impact out there will be meaningless. If the intention is to exempt the underprivileged, the poor people in our society, then that 100 cities need to be reviewed.
To what?
To 1,000 Ghana cedis per day.
1,000?
1,000 Ghana cedis per day.
So you're saying that unless you're sending more than 1,000,
that's what it is.
Then it shouldn't apply.
Exactly. Because
but that's
look,
unrealistic.
It is very realistic. So if today I've worked somewhere and I have, let's say, 1,000 Ghana cedis, an ordinary person, assume that I'm an ordinary person. I'm in Accra, my parent isn't well, I'm remitting money home. And I send 1,000 Ghana cedis. That person per day, it doesn't mean the person should wait day 1 to go and send 100 Ghana cedis, day 2 to go and send 100 Ghana cedis, day 3 and wait for 10 days before they remit that to get all those tax exemptions. No. So grant it at 1,000 Ghana cedis at the minimum. So that has been our position.
President Ekufuor says his administration will not tolerate auditors who are either complacent or incompetent. He has charged auditors in the various districts to efficiently execute their responsibilities in plugging leakages in the public purse. The president was addressing the maiden edition of the District Auditors Conference in Kumasi under the theme Ensuring the Efficiency and Effectiveness of State Auditors in a Digitized Economy. He stressed he is unhappy with cases of financial malfeasance consistently uncovered by the Public Accounts Committee.
I've been made to understand that the Public Procurement Authority, by simply reviewing contracts brought before it for approval under either restrictive tendering awards between January 2019 and August 2021, recorded savings to the tune of 2.3 billion cedis. This is what can happen when our institutions work. In all of 2017, the year before I took office, the authority made 0 savings. In your own individual workplaces, you can cite your own examples of what you would save the country simply by insisting that people go by the book. We are human, and I admit that there will always be those amongst us who will try to abuse the system and undermine whatever structures there are. There will be some who will try and see what they can get away with, and there are those who might be making genuine mistakes. It is precisely because we acknowledge the reality of human frailties in all our efforts that we have auditors. The daily and constant checking of systems ensures that the public purse is protected and respected. Every time we wince at the details of the reports of the Auditor General and the hearings of the Public Accounts Committee of Parliament, we know the district auditors are not working as they should. Unfortunately, it has become routine for the Auditor General to uncover cases of financial malfeasance in the public service that would otherwise go unnoticed until he or she appears. It is not pleasant, but we cannot avoid the conclusion that the district officer, the district auditor, must then be either complicit or incompetent. We cannot afford to have auditors that will be complicit in the malfeasance they are expected to prevent. And certainly, we do not need incompetent auditors.
Barring any hitches, the Rollins Park will be devoid of human traffic, particularly on the streets of the Accra Metropolitan Assembly. Is set to relocate the hawkers there. Over the years, successive governments have tried to rid the pavements of the hawkers who sell by the roadside to no avail. But the AMA says it is bent on relocating the hawkers by January next year to a new market it is constructing. There's more in this report.
The Rollins Park is a popular trading hub which attracts traders from across the country and beyond. In the past, successive governments have attempted through brute force to evict them from the pavements with little success. The hawkers say they prefer to sell by the roadside because it attracts customers to purchase their goods. For them, the AMA's decision to move them into the market wouldn't do them any good.
Many people buy from us on the streets. Customers buy from hawkers on the streets because it is convenient. The market should have been buzzing with activities, but this market is quiet. I have sold just 2 pieces of clothes since morning.
But Accra Mayor Elizabeth Saki says the Assembly will educate the hawkers in a bid to persuade them to move by January 2022. She, however, warned the recalcitrant ones will face the full rigors of the AMA's bylaws.
Regarding those seated by the roadside, assuming they've all come into the market, I don't think there will be people buying outside there because there will be nobody there for you to buy from. And I've even thought of it, that since we have policies and regulations regarding the assembly, those policies and laws and regulations that needed will be adhered to. So we'll from next year try and then advocate to speak to people, and then they will understand, so that they will start getting into the market. And the implementation will be done. There are bylaws, and they already know. When they get there, they'll know.
The AMA says the relocation of the hawkers and construction of the market forms part of efforts in making Accra a beautiful city. Meanwhile, the Assembly has taken delivery of 3 trucks from waste management company Zoomlion Ghana Limited towards the Operation Clean Your Frontage initiative. Raphael Loko is Director for Jobs at the company.
Okay, so it has always been the call of the President to ensure that Accra becomes the cleanest city. And the support from the Regional Minister, Honorable Henry Korte, at Zoomlion Ghana Limited and just one group of company. This is where we are the giants and we fit in. So we see as private sector how we can partner with government to ensure that the vision comes to bear or is implemented well.
The Accra mayor, who received the tracks, expressed gratitude to them for the kind gesture.
I'm really happy and I appreciate this gesture. This has really come on time. It's timely, and I should say a big thank you to the Zoom Lion group of companies and the organizers of Operation Keep Your Frontage Clean. I really appreciate that.
Operation Clean Your Frontage was initiated by the Greater Accra Regional Minister Henry Korte in a bid to make the national capital one of the cleanest cities in Africa. Sarah Mensah's report for JoyNews.
It's just 2 days to Christmas, and the annual beautification of the Liberation Circle and other principal streets of Accra with lights is back. One of the people behind the transformation of the capital into City of Lights, CEO of Jandel Limited, Afi Amoro, says most of the materials and designs used for the lights were locally made. She spoke to JoyNews at the launch of a ceremony. So the hashtag Light Up Accra.
Joy, peace, happiness, love, all these are positive things. Let's dwell on the positive things rather than drown ourselves in the mundane, because to every cloud there is a silver lining. Yeah, you'll be seeing Christmas related designs, but the beauty of it is that we have manufactured these things ourselves over here with hard-working artisans, and we are very happy that the foreign components has not been too heavy, and we have also Ghanaianized some of the products. If you go to the Ridge Runabouts, you'll find that a young man has used plastic bottles to create a Christmas tree. We gave him exposure, and this is what we want to do. We want to expose talents, young talents who come with that mentality of doing Ghana to make Ghana great, to make Greater Accra great. So when anybody has any assets, we are willing to look at your concepts and help you to give the platform for you to do what you are doing.
Greater Accra Regional Minister Henry Korte at the same event urged the populace to create long-lasting memories at this festive season.
This year's event promises to give Ghanaians a spectacular and exciting experience. This December, the Regional Coordinating Council, in partnership with Messrs. Jandel Limited and Malin Law, will light up the capital with beautiful illumination across the streets of Accra. The Light of the City 2021 will enhance the Christmas celebrations as a high point for the festive season and bring excitement within the city. All lights go up in Accra as we mark our Christmas season memorable with our friends and family. We are bringing you the best experience you have been waiting for in a livable city such as Accra. I will therefore urge the people of Greater Accra and even beyond to pin the fun and create beautiful and long-lasting memories at this year's event.
We're still live on The Pulse, and we are also live on all our social media handles. You can also tweet at us with the hashtag The Pulse. We'll take a break. When we return, we're bringing you the very latest from the world of sports.
Hi, this is Lexus Bill, host of Drive Time on Joy 99.7 FM. Listen, you don't have to worry if you miss Drive Time or Personality Profile. It's going to be live on our podcast page. Just log on to www.myjoyonline.com/podcast. You can listen to Drive Time, Personality Profile, and any other of your favorite shows on Joy FM on that page. You don't have to miss a show at all. Joy 99.7 FM, radio for discerning listeners.
Thank
Thank you very much for staying here with us on this channel. It's the holiday season, and as we've promised you, we're going to bring you a lot of big conversations as we review what's been happening in the year 2021 in sport, and also look ahead to major events that will have a telling on what we'll be seeing in the year 2022. My name is Nathaniel Atto, and today I'm sharing the company of one very big boxing operative when it comes to Ghana and its standing on the international scene. Now, he's been involved in many of the big fights that have been put together here on the local scene, and big fights in which Ghanaian boxers have been involved on the international scene as well. He currently serves Richard Schiffer's Probellum as the talent manager global, and he has a lot of work to do in that regard, especially when it comes to helping some budding Ghanaian talents to get out there in the world of boxing. Our very own Mike Altamira is my guest today for this conversation. Mike, good to see you.
Thank you for that lovely introduction.
Yeah.
And it is, again, it's an honor to be in the presence of the Michael Buffer of Africa.
Thank you.
So it's always a pleasure to be in your presence. It's been a long time now. Obviously, COVID's been a bit of a stumbling block.
I know, man.
We travel, but it's always great sitting with you. And yeah, there's some really exciting developments. So one of the first things, so I was actually a free agent for about 2 months in the pandemic. So it comes with a rush of excitement, comes with negotiations with different entities and so forth. And one of the first conversations I had when I was approached about joining Probellum was what kind of impact. So the company's whole mantra is fighter first. So my question was, right, what kind of impact can we have in the places that are dear to my heart? And a lot of companies in boxing, so they'll structure, but they only want to invest, they'll invest in African talent once African talent hits top 5 in the world. Before that, they don't want to know. They don't want to know about building the grassroots up because they perceive it as a money pit, whereas I look at it as an investment in the future. And so I wanted to, whatever direction I was going to veer towards, I wanted to be where I could combine a number of passions. And the great part about Probellum is that we're being proactive in building global partnerships around the world. And one of the first partnerships that I was able to piece together was a co-branding, a co-promotional partnership here in Ghana with Alex Nitamora of Box Office Sports. And I think that over the next, say, 3 to 5 years, I think we're going to be able to cultivate a lot of great opportunities for young Ghanaian athletes. And my goal is within 5 years to bring a World Championship bout to Ghana. And then, you know yourself, look at even the great Azuma Nelson, for everything he accomplished, Hall of Fame career, only one world title bout in Ghana. I want to change that for the future. The next great Ghanaian star that comes through the sport, I want it to be the opposite. I want it to be, if they have 10 world title bouts, 9 are here at home, 9 are at the advantage of the local fighter, and maybe one's in Las Vegas when, that monster payday presents. So I think that we're starting from the grassroots up, and I'm really, really excited about what the next few years is going to present.
So if you just joined us, this conversation is with Mike Altamira, who is not a stranger at all to Ghanaian boxing. And Mike Altamira is the director in charge of talent development for Probellum. Now, Probellum is owned by Richard Schiffer, who used to be in charge, or used to be the CEO of Oscar de la Hoya's Golden Boy Promotions. So it's a big deal. And now, Probellum are looking forward to doing a lot with Box Office Promotions of Ghana, headed by Alex Ntiama. And of course, that in terms of, some of the most fluid promotional stories that we've seen over the years have had to do with Box Office Promotions. Now, Mike, in the coming days, we're going to see another big fight night.
Yeah.
That is part of this collaboration and is starting off this collaboration. Michael Ansah, we saw against his longtime sworn rival, had a second win out of 3 with him.
With Sheriff Quay,
with Sheriff Quay, and he's looking forward to doing even bigger things. Tell me about this fight night and how crucial this is for Michael Ansah and his bid to go forward.
Well, I think it's all in the tag of the fight night, which is prepare for war. So if you know, our actual company title, Probellum, is a play on the Latin word parabellum, which means prepare for war. And it's no false advertisement. It's going to be war. This is a real grudge match. Ansah, I believe, lost twice in the amateurs to Michael Dodo. There's been a lot of talk in the community about who's going to be the better man, the bigger man. We're going to find out on the 24th, but it's fireworks guaranteed. The great part is that the card's absolutely stacked. Beneath that fight, there's 3 Ghanaian national title bouts. None of them included Maxwell Wuku, who's on the card. George the Red Tiger. It's a stacked card.
Wow.
And the thing is, we are fully in trust in the vision of Alex and his team. The styles make sense. With boxing, styles make fights. All the styles are made for fireworks. So I know it's the 24th, but the fireworks for New Year's are going to come maybe a week early. It's going to be a great night. And, you know, one bullet answer and Dodo, I don't know who's going to win. It's a genuine 50-50 fight. Terrific fight, and that's why I implore all Ghanaians to get out to the Book on Boxing Arena. I think it's going to be a great way to really start to bring 2021 to a close.
Okay, so that's Christmas Eve. All right, now, you mentioned the likes of Maxwell Awuku and George Red Tiger Ashi.
Yeah.
Now, George Red Tiger Ashi at a certain point was a very big potential, somebody whom many were seeing as the future of the lightweight division. Unfortunately, that one loss that he suffered to Emmanuel Tego is something that sort of looked like a setback.
Yeah.
What does it look like for him as well? From where you sit, for someone like George Red Tiger Ashi, is it still looking good for him? Is he able to pick up the pieces and move with a fight night, with a big card like this?
Yeah, well, he's a little bit older, but I think one good thing that comes under our umbrella is a lot of global exposure. So maybe there's, you know, we have partnerships in almost 20 countries now. So maybe one of our other partners around the world sees the Red Tiger for the first time and says, you know, I think he'll match well with our boxer. And then at least he's not traveling where he's treated like an opponent. He's traveling where he's going to be taken care of, he's going to be paid accordingly, he's going to be looked after. And I think that someone like George, because of his age, he's deep in his 30s now, he's going to have to travel on the B side and flip the script, but I think he's capable still. He's got a lot of ability. I'm looking forward to actually seeing how he performs. I haven't watched him fight in a couple of years, so see how he performs and see what presents. But that's the exciting thing about what we're doing with this series, is that we're going to have consistent events. It's going to be minimum 5 events per year, and just give these fighters a chance to build and grow.
Now, this bit about Maxwell Awuku as well. Maxwell Awuku some years ago had the opportunity to fight for a major world title.
WBC world title,
yeah. He fluffed that opportunity. Clearly he was, I mean, not up to that standard at the time.
Yeah.
And you look at his record, he had quite a number of fights.
Yep.
And so what is it for him as well from your end?
I think similar to Ashi. I think it's just a build back. That's what it is. With guys like that, one loss, especially at a national level, and it's game over. So it's high stakes to keep winning, and just hopefully the right international opportunity presents. But you never know. Someone like Awuku, we have, you know, there's a kid I'm really, really excited about on the undercard, Alfred Lamptey, 19 years of age.
Well, Alfred Lamptey, who won the WBO title, the WBO Africa title.
And just was awarded the Ghanaian Professional Boxer of the Year.
Yes, at the Swag Awards.
Correct, yeah. He's got a tough fight. Charles M. Tefio, 10-0, but I think Lamptey's definitely up to the standard. But you know what? He's moving up to 130 pounds. Maybe Maxwell Awuku is a good checkpoint for him next year. Test himself against someone who's been there, challenged for a world title, very experienced, and if he can beat somebody like that, then he qualifies to go the next step as well.
Wow, interesting stuff there. Now, how excited are you about 24th night relative to what has happened on the boxing events calendar here in Ghana? I mean, you know what the story is like, and you know how things have gone.
Yeah, I'm excited because, like I said, it's great matchmaking. It's getting everyone in line for the festive season. So my hope is all the fans leave the venue that night happy, satisfied, content, get their money's worth, which I absolutely believe they will, and then roll it into Christmas. Don't go too hard on Christmas, please. You know, leave that to the fighters in the ring on fight night. But I think it's just setting the trend for what we want to piece together. Like I said, these next 3 to 5 years, we really want to lift the standard here in Ghana, which is to be able to bring international opportunities. And from my side, I want to showcase to our internal team just the tip of the iceberg of what's capable here. You know, I was fortunate to be involved in a World Championship level fight here in Ghana, and that was an unbelievable experience.
Mike, thank you so much. It's been wonderful sharing your company, and I'm looking forward to that fight night, Christmas Eve, and it's happening there at the Buko Marina. It's sure is going to be a wonderful one. Michael Ansah, the One Bullet, coming up again and headlining that very big bill, and it sure is going to be another cracker of a fight night. So a lot to look forward to in the coming year. It's been wonderful, in as much as it's been challenging, just like Mike has said. So let's cross our fingers, have a very good one on the eve of Christmas, and then after that we can look ahead into 2022 and do some big projections for our boxers and for the sport in general and its growth and its you know, relevance when it comes to the economy and all of that. So thank you very much for watching. Like we said, and like we promised, we're going to be bringing you a lot more of these conversations around this period. And so thank you so much, and I will be on your TV sometime soon. My name is Nathaniel Atta, and I have love for sport.
Hello, my name is Evans Mensah, and you can relive all the fun and excitement on Top Story, Newsnight, and of course Ghana Connect via podcast. All you need to do is to log on to my Joy Online/podcast. Search for your favorite show and relive the moment. Joy 99.7 FM, your radio for discerning listeners.
Joy 99.7.
And that's how we part company on the Pulse this afternoon. My name is Aisha Ibrahim. For more news, log on to myjoyonline.com. Over there, you'll find updates of all the developing stories. Up next is Let's Talk Showbiz. Enjoy the rest of our programs. I'll be back at 7.
Hello, I'm Dori Nando. You can catch up with all the fun on the Cosmopolitan Mix and on all our shows via podcast. Just go to My Joy Online podcast and search for your favorite show and relive those moments all over again. Only on Joy 99.7 FM, radio for discerning listeners.
Super Hits Radio, Joy 99.7.
Was this what you were expecting?
I'm grateful. Big is the word.
How would you rate your year 2021?
It's been filled with a lot of work and a lot of reward. So I'm really thankful to God, you know.
I know that you have the December is almost over, and I know that you have a couple of shows. This is your major show, but in all, 2021, how would you rate the year? Which one will be like your peak moment of this year?
I think I'll put it on today, because today is what I have, today is what I see, today is when I have the opportunity to do the most. So I thank God for today.
What is the purpose of this meeting with the ambassador of the UAE?
So we are here with Mr. Amel, and the main purpose is that we are trying to foster a cultural exchange program between tourism, arts, culture, and even maybe business. So myself and Adansi Travels, we are taking 50 people to Dubai from the 5th of January to the 12th. It's sold out, so don't even bother. We are taking 50 people, and then when we go, we'll visit the expo. And so we have actually come here to find out how we can take Ghanaian culture and music especially, and get us the opportunity to perform at the center stage whilst we are in Dubai, so that we also bring people from Dubai to visit Ghana for the Beyond the Return national campaign that we are embarking on.
So what has been achieved today as you came here?
Oh, a lot. We've been given the opportunity to visit, and then also some of the little things little advantages that we can take. So we currently learned that there's a sort of like a global village for a very diverse audience, which people can actually visit with their children and listen to music, and maybe I'll get opportunity do my things on time, so I'm really excited about it. I'm to send my proposal today so that they can fix my name, so that whilst we are in Dubai, we can take Ghana along with us, with the kente, the ahinema, with the music, with the high life, and with the live music. So
Gideon, already you have actually sold out on taking families to Dubai with Ochani Kwame and the family, but what was the essence of this particular purpose of this meeting from your point of view?
Yes, so we wanted to officially let the embassy know what we are doing in promoting the culture between the two countries. And so the purpose of the meeting to officially inform the embassy and see how we can enhance the experience that we've already planned. So as we came, there have been a lot of suggestions here and there, and to me that is very exciting, because as we already have with their inputs, we can see that we are going to rather enhance the experience and even get a bigger audience. So we are not just looking at the small number we are taking, but a bigger audience in Dubai through the expo and through the Global Village platform. And we are excited and look forward to that.
Is that to say that this trip with the OK family is not going to be a one-off thing, but is going to be repeated with this particular meeting?
Yes, originally it's not one-off, so it's actually not one-off. It's a whole year project that we are embarking on. So we chose Dubai as the starting point, and we intend to visit other countries. So the main highlight or the climax is in December next year, where we have a big festival here in Ghana called Discover Ghana. So everywhere we go, we want to invite as many as possible to Ghana. So going to Dubai in January, we are looking at maybe 500 people saying, yes, we want to come with you to Ghana because we love what we have seen, a little we've seen. So, and we are happy to have the embassy open their doors. And I'm sure from the conversation, you can see that they are also eager to promote that cultural exchange between the two countries. And I was delighted to hear that they are also pushing for the international that mutual arrangement where visas is for each country, and they're excited because they know a lot of people in the UAE are willing to come here if that barrier of visa is removed. So we are taking the opportunity to appeal to the relevant authorities for that to happen.
In this season of giving, sharing, and gratitude, we pause to appreciate you, the special people who made our journey joyful. We say a big thank you. From all of us here at the Multimedia Group and our families to your families, grateful hearts. Asida, Christ at work.